friends that developed COVID after the vaccine. I have a friend who developed all sorts of other complications after the vaccine. This was not true. It was obviously not related to the vaccine. So it is such things that really calls for us to expand our community involvement. Over.
Thank you so much, Dr. Godfrey. This was very insightful. So, with those two introductions from Dr. Tesfaye and Dr. Keeper, audience, it's over to you now. I'm sure you had burning questions when you joined the seminar before, or even as you have listened to our speakers share. So please go ahead and type in your questions into the chat, and as it comes, we'll respond to them. So I'll start with the first one that has come in. It's for you, Dr. Anyatu. It says, Dr. Anyatu, thank you. What is the main cause of hesitancy? Is it religious, geopolitics, and the various side effect reports? Lack of evidence, lack of trust in the public system, etc. Is there a potential thought for the Ministry of Health to mandate the vaccine for health worker groups? So that's the question for you. What is the main cause of hesitancy, and is there potential for the government through the Ministry of Health to mandate the vaccines for health workers?
Okay, thank you, Maraki, for your question. So, to be honest, my main cause of hesitancy was about the infertility, because as we know that there are many rumors about the female infertility which have been mentioned on this vaccine. So, I am a young, of course, I want to have more children. So that was exactly my fear, not to actually initially to take the vaccine. Later, so this rumor, which is a wrong one, has been disproved with different researches. After that, it has been started to be allowed for all the pregnant women to take this vaccine. And apparently I have witnessed lots of women who conceived after taking the vaccine as well. So I avoided that fear and I took the vaccine. So this was my main cause of hesitancy for myself. After that, I took the vaccine, and actually I'm now pregnant as well. So you see, it's okay. So also, I didn't see any thoughts, or I didn't observe any mandate or any commands or forcing from Ministry of Health in the line of mandating the vaccine for the healthcare workers group so far. So more, I am thinking, to be a very good input, or we have to work with the Ministry of Health strongly as a physician in order to change this attitude. And this has never been, pushed as it has to be pushed so far, especially in our country. Yes. And also the other experience that I want to share is from my personal experience, from my personal experience, since I'm a part of RD Associates. So I'm healthcare workers. I have a fear by myself, and I was hesitant to this vaccine. So what we're trying to do is just to share our experience to the public. So we tried to gather some of the daily labor workers who are working in the one construction company, so that, in order to address their main questions in the line of vaccine hesitancy as our day associates. So it was a very helpful and very good discussions, and we were able to address majority of the public questions on that particular gatherings. So as our day, we were trying to do this. So this is also my experience to share here.
Thank you so much. I think, this is so impactful. It's not just saying that it was, the whole rumor around infertility was you're a living witness. Now you're expectant, and, we hope that you're expecting twins or, multiple babies at the same time. And I think, we will have you as a good case study to share with the whole world. So Dr. Keeper, I just a question for you. Listening to you and talking about the comorbidities, how do you think, we know that, comorbidities is also quite high in Africa, cases of diabetes and hypertension and other comorbidities. How do you think that there has been enough information shared around, especially targeting those groups through primary health care professionals? Has there been enough information shared with that population, or is there more that can be done in Zimbabwe and in Africa as a whole, as a continent?
Yep. I referred to the conversation that I had with some of my workers, and these are sort of domestic workers who were very articulate. And one of the things they pointed out that there's not been enough information. So clearly, what the message I'm hearing then is we need to do more. We need to do more informing people about that have diabetes, that have hypertension, that have other conditions, that having the vaccine is common sense because of the exposure and the risks that you have. So we really need to do much more in terms of informing people. And remember that we cannot rely simply on our traditional or usual health workers. Many years ago, when I was doing my postgraduate, one of the things we're told is that in a given population, only 1% of the population ends up in a health facility per year. So, which means that we need another mechanism to reach the general population. We cannot rely on them simply going to health facilities. So we need to do much more through other channels outside of the usual primary care facilities. So we need to make use of other ways of communicating. And one of the things that was pointed out is make use of community leaders. Make use of the people that live within the community, that interact on a day-to-day basis with the people that have these comorbidities or that have other conditions. So the short answer to your question is no, we are not doing enough, and we need to expand our approaches to go beyond our usual traditional health workers.
Thank you. And just to the question that I think I'll put that to you as I end this, this first session. A question also came in from Angela Waneri that says, given the need to get more people vaccinated, should African governments allow private healthcare facilities to administer vaccines? What are your thoughts there? I think about it and know that, the private sector also, is a profit-making sector. So putting that into play, what do you think should the African governments allow private healthcare facilities to administer vaccines? Please, Dr. Godfrey, you can start, and Dr. Tesfaye, if you also want to take on that question, please do, and I would round the panel after that.
Yes, thank you for that very important question. The answer is a simple, definite, big yes. Governments need to allow or to involve private health providers. We can come up with the modalities of involving the private sector. And we also need to remember that there is a big population out there, big percentage of the population that actually prefer to receive their care from private practitioners. So if that is what the population wants, why should we have to not allow that? We need to allow it. And I'm happy to say there are a lot of countries in Africa that actually have done it, that they allow their private practitioners, their private health sector to participate in vaccinations. Thank you.
Thank you. And Dr. Tesfaye, anything you want to add on to that as we round up this session?
Of course, my answer is similar. Yes, we have to allow all, the healthcare workers to engage in this activity. There shouldn't be any limitation. Yes.
So thank you so much to both of you, and thank you so much to the audience for your questions that you have put across. And for those that are a bit shy and still thinking, please, I hope that you've had a cup of coffee or a cup of tea, and by the time we get into the next session, you would have, you put your thoughts together, and we look forward to also getting your questions for our esteemed panelists to respond to. So without much further ado, I'm really going to just say to Dr. Godfrey and Dr. Tesfaye, thank you so much for this engaging conversation and for the perspective that you have shared regarding vaccine hesitancy. I would also use this time to welcome my other two panelists that will be joining us. And my first speaker is Dr. Panagis Galasitos, and my second speaker is Dr. Iyabo Obasanjo. Very much, we're really glad to have both of you here, and we welcome you to this second session of our conversation. I will just turn it over to you to please introduce yourself. And Dr. Panagis, I know I mispronounced Panagis, the easier one. Please, my apologies for that. And please start off by introducing yourself before we go to Dr. Iyabo.
Of course, and thank you so much. And it's just such an honor to be here on this panelist. And I think being present here also emphasizes how much, being a pandemic, we're all in this together. And while we're focused on Africa, the whole world should be invested in every part of the world to make sure that we end this pandemic. So thank you again. I'm an assistant professor at the Johns Hopkins School of Medicine. I'm a physician in pulmonary and critical care medicine. And finally, for the last year or so with the pandemic, I've been involved in 3 phases of it. Prevention, so a lot of community engagement to help people stay safe and understand the vaccines and infectious control. I've been in the intensive care units, managing patients struggling for their lives with COVID-19. And I'm one of the 3 physicians at Hopkins who runs the post-COVID-19 clinic. So thank you again.
Thank you so much, Dr. Panagis, for that introduction. And Dr. Iyabo, please, can you introduce yourself?
Yes, yes. My name is Iyabo Obasanjo. I'm an epidemiologist. I am on the faculty of William and Mary, which is a university here in Virginia, in the US. So I teach public health courses. At the beginning of the COVID epidemic, I was involved in some how we de-densify our campus, and that led me to being on the public health advisory team of the university